Yes, hi Cameroon, and nice to meet you. Welcome back, and it's good to meet with you today. As you know, my name is Maureen. I'm your provider today. So, yeah, I have reviewed what you shared about your focus, forgetting assignment, feeling disorganized, and having trouble keeping up with both the school and your new job. These are really common challenges for adults with ADHD. And good news is that we have two strong medication options that can help you get better and get back on your track. So I'm going to introduce this medication to you. And the two medication I want to talk about to you through today are Vyvanse and Strattera. So both are FDA approved for ADHD. Both are safe for adults, and both can help with attention, organization, and impulse control. So, but they work differently, and one may better fit your needs than the other. So let's start with Vyvanse. It's also called Lisdexamfetamine. This medication is a long-acting stimulant. It works by increasing dopamine and norepinephrine in the part of the brain that control focus and planning and task completion. So one thing that makes Vyvanse unique is that it is a prodrug. That means it has to be activated in your body before it starts working. Because of that, it tends to have smaller effect throughout the day, with the rays of up and down feeling that some people get with the other stimulants. So for the benefit for you, all right, Vyvanse could help you stay organized, remember assignment, keeping you track on your work schedule, and reduce kind of mistake that has been stressing you out, right? So it usually lasts about 10 to 14 hours, so it can cover your class and your shift at the bookstore. And because of the way it is observed, it has a lower risk of minimize, which is especially helpful in a current environment. There are some side effects for this medication, and the most common are decreased appetite, trouble sleeping if it's taken too late in the day, and dry mouth, or feeling a little more irritable. So some people notice a slight increase in heart rate or blood pressure. So we'll keep an eye on that. We also need to monitor your blood pressure, heart rate, appetite, sleep, and mood regulation regularly. So if anything feel off, you just let me know. So the other one is Strattera. It is non-stimulant. It works by increasing norepinephrine in the brain, but doesn't have the same stimulant event as Vyvanse. So it's not a controlled substance, and there is no risk of misuse or dependence. So benefits are like Strattera can be a great option if someone prefers a non-stimulant, as concerned about appetite or sleep, or want medication that lasts a full 24 hours. It can also be helpful if someone has mild anxiety along with ADHD, because it doesn't tend to make anxiety worse. This medication as well has side effects, and they're like nausea, fatigue, dry mouth, or feeling a little slowed down at first. There's a rare risk of mood changes in young adults, so I'll check in with you regularly about how you are feeling emotionally. And we're gonna monitor your blood pressure, your heart rate, appetite, and mood. But one thing, or that important thing to know, is that these medication take longer to work. It take 2 to 6 weeks before you feel full benefit. So my recommendation today, based on everything you have shared, especially the forgetfulness, disorganization, and the impact this is having on your brains and your job, I recommend starting with the Vyvanse. You have taken stimulants before and didn't well with it, so Vyvanse will give you the fast and improvement in the area that are causing the most stress right now. So Strattera is still a great option, and we can absolutely use it if you prefer an stimulant, or if you don't want to tolerate, you won't tolerate the Vyvanse well. But for immediate support with your academic and work demands, Vyvanse is the strong fit. So my goal is to help you feel more in control, more organized, and more confident in your day-to-day life. So we will start low, go slow, and adjust as you feel. And you can reach out anytime if you have any question or concern. And I think that's what I think today we could conclude. How does that sound so far? So